there are some wonderful old statistics books. So you read them. You don't even have to go through, because I think these guys went very deep. All these guys, like I said, I'm impressed by Springer. He's no dummy. He went very deep. He knew a lot of stuff, but he didn't draw the right conclusions. To draw the right conclusions, when you look at all these things through the drug world, your mind will play tricks on you. And that's what happened with Matt and 𝗥𝗡𝗡 too. You have to look at it through an abstract lens. And abstractions are painful things. If you've ever coded for a living, you could tell, you guys all know, anybody who codes, learning abstract things are very, very, very difficult. But you have to look at it at the abstract level. Because if you look at it at the granular level, with a specific example, you're going to tend to want to stop using too much logic. Or you might think you're using logic and you're not. But if you stay with the abstraction, take away that it's an Alzheimer's drug, take away that it's a molecule at all, take away anything, that it's ADAS-Cog, just look at the abstraction. What will help you understand that? And then now you're down to bare basics. And you really have to study type 1 error, type 2 error, look at hundreds of examples from the past. I think that's one of the things that a lot of people didn't see. And I tried to point out to 𝗥𝗡𝗡 actually how perilous it could be to look from phase 2 to phase 3. So I pointed out 𝗪𝗏, which was a really simple, phase 2 that failed to replicate. And he kind of hand waved it, and I bet you now he regrets doing that. He just was like, oh, Martin, this was a Ukrainian and Russian study. And it's true that it was in Ukraine and Russia, but that doesn't mean that the data was fake or that it was wrong. It's just one of the things I mentioned. The other one I would have mentioned is, of course, bapineuzumab. And bapineuzumab had a 0.07 p-value in phase 2. Very close to approval. And that disappeared in phase 3. Right? So if you take away all of the questions about Alzheimer's and ADAS-Cog, that stuff can actually lead you astray. You think you're gaining knowledge, but you're losing it, because you have to look at this through a purely statistical lens. And some people think they were doing that, but I'd encourage you to read real statistical textbooks. The threshold is any effect size. That's the thing that, again, folks, I think don't seem to understand. If you have any reliable effect in Alzheimer's, you'll get approved. Any. The threshold for statistical significance does not tell you anything about the effect size, of course. But generally, if you're less than 0.01, that's a reliable effect. It could be a very small effect, but as long as it's there, it's reliable, and the side effects aren't attendant to it, you can be in very good shape. But again, really mastering t-tests, distributions, and what they mean is something a lot of people don't want to do. And if those don't do the trick, because people, a lot of us have studied that, I would just look at old pharmaceutical history. Bapineuzumab, really point this out as one of the most famous drugs of all time. Really, really, really important. And baseline imbalances are probably one of the most underlooked things too, because you can have a really good p-value, but if you're comparing an imbalanced group to an imbalanced group, you're doing a trial of good patients or bad patients. The good patients are going to win. So there's lots of little, I think history helps you. A lot of people make these mistakes, their first trials as well. But if you've done lots and lots and lots of trials, even a guy like Adam Fierstein, who's not very smart, can see the cassava thing from a mile away. But that's experience for you. But if you add experience and intellect, now you might be cooking. I don't know that matters, bio, because the way I look at that, okay, let's go back to the Alzheimer's. Okay, ground truth for an Alzheimer's study, right? This is 365. These are placebo-controlled studies. 3 is smack dab in the middle of the average for ground truth. And when you do a trial, your trial is now ground truth. And your trial is a function of many variables that go in it. It's a multivariable function. And those include study sites, their locations, mild versus moderate, ApoE. All those things go in to get this readout. Who's the study coordinator? Who's the CRO? Just the CRO.
Order partially filled.
Just the CRO.
Order filled.
Okay. Will bias the ADAS-Cog output. So these are ADAS-Cog outputs from lots of trials. They go all the way up at 1 year to 9. Okay. All the way down to, in the middle here, around 3 or 4, which is what happened in this study. And even all the way down to -1. But it looks like the minimum is 2. So they did a little bit better than average, but that's not, I think you're thinking about it backwards when you say that, oh, it should do like these other ones. Well, it should do whatever it does. It's gold standard, it's ground truth right away, just because you ran the trial. And comparing across trials just doesn't make sense because it's not the same CRO, it's not the same doctors, it's not the same high enrollers, it's not the same ApoE, it's not the same raters, it's not the same clinical trial managers, it's not the same CTAs, it's not the same, it's not the same DSMB. Those are all different variables that go into a function, and the output will be blended ADAS-Cog. And the blended ADAS-Cog here is something like 3 or 2.5 or something. And that blended ADAS-Cog is now it's now up in the Parthenon. If this was a well-conducted trial, other trials will look at this and say, this is roughly what we can expect. But you can't say we're going to expect exactly the same unless you can go to every single thing and replicate it again. Same company, same CRO, same CTA, same CTM, same scale, same readers and raters, same data handling. Like everything has to be exactly the same, and there's no same. The same conditions will not occur twice. Same ApoE, same concomitant medicine, same prior medicine, same age, it's stuff that you cannot exactly replicate perfectly. So, you're going to get some differences. And if you got all ApoE patients, right, ApoE4, these guys are going to gain 7 points after a year. If you got no ApoE patients or even got some ApoE2s, they're going to gain 1 point. So, we all make mistakes. I think you're looking at a guy who's made hundreds of mistakes in his life, some that you've read about in front pages of newspapers, some you haven't. But what are you going to do? You keep fighting, pick yourself up, dust yourself off, and move on. Elon made a bunch of mistakes. He almost went bankrupt. So you just, keep going. It'll be the smallest mistake by the time you're done with it. I remember one time I lost $2 million to a brokerage and I couldn't pay it. I was so embarrassed and man, I was just in bad shape. I ended up paying it years later and ended up being not that big of a deal. But it was, it was a real big setback for me. I was like 25 or something. It'll be a small mistake in the long run. You become worth $100 million. You're not going to worry about 600 grand you lost when you were a kid, or when you were younger, I should say. Oh, please, Kel, you just make a business, sell part of the business. Look at the guys that made AVXL. They spent no money. Look at the history of AVXL with SEC filings. They spent no money. Yeah, I think that's a big one, not to think of having to make your losses back right away. That's huge. So you try to force it, you're just going to lose more money. That is huge. You take a deep breath. You don't try to force it. And look, the biggest amount of money is made with other people's money. Like AVXL, these guys took this drug. I have a lot of history in this company. They basically took no money and made this into a $1 billion company. And its drug doesn't even work. So, you could have created your own AVXL and made $50 million by holding on to 5%. No, that's not true, Henry. 600K is small for some hedge funds. So I can put you on right now to drugs where if you bought the drug, okay, you could buy the drug from one of these companies. You can download these GitHub models. Lilly has drugs they quit for Alzheimer's that you call the right guy at Lilly. You just go on LinkedIn and say, I'll pay $1 million to license your drug, and go license the drug, you got to go find $1 million at the same time. But I'll tell you about that later. And you'll go put it in a publicly traded company like Cassava right now is a shell. They have no assets. They really need an asset fast. You can go make a deal like that. You could probably flip that for 10x and get a royalty. You know, so all is a couple phone calls. You might do it in 1 week. I've licensed a lot of drugs for cheap. I've licensed drugs for expensive. You know, you might call 827 for the loan. There's some rich guys here. Call up 827. You might want to call up some of the guys in my Discord, but you know, you can find the loan. And even still, like Lily might say, you know, give me 100 grand and pay me 900 later. There's a lot of ways to do it. There's a lot of ways to do it. So don't be discouraged by a loss. You know, very few of the Cassava people have to say, I'm still in it. I still want more. Give me round 2. I want to fight more. So there it is. Now, I don't know which drug at Eli Lilly. I don't know exactly, you know, where to go with it, but you can find it. It could be at a university. It could be wherever. And then you'll make back the whole 600 plus 10x in one shot. Might only take you a couple months to do the whole thing, if you're lucky. Now, a lot of times it's not that easy. Yeah, other than me. I mean, I have. Crypto is a very, very fast way to make lots of money. It's a little dirty, but you can make a lot of money in crypto very quickly. But yeah, I'd just start a company, take it public, sell your company to a shell. Again, easier said than done, but the second you buy that asset from that big pharma, or that's even that small biotech, your company's worth 10, 20 million. You just made that much money on paper. Now you got to go make it reality. But at least you're halfway there. And look at AVXL. They made their reality. That drug's useless. That drug makes the Cassava drug look good. So if they can get $1 billion market cap, maybe you can too. Dump all your stock, rinse and repeat. Intel patent here, processor-related communications. We're learning the semiconductor space. This seems boring and slow, but you'll see why it's very important later. Back to school, we're going to get rid of them. We're just waiting for any of these 5 biotech trials to come out. Huma, Galt, Candle, SLS, or Neumora. They're all supposed to be coming, I think, this week. At least a few of them will be this week. We should get some of them today. We're getting Biomea. Biomea is out. Preliminary data. Leukemia. Not what we expected. Fate data is out. Biomea might squeeze those shorts. They don't report it at the same time. Yeah, most of the news is scheduled for after the market. Saquon Barkley, man, the Giants, we should never let him go. It's 405, 410, 415, 420, 425, and 430. 405 and 430 and 5 o'clock are the biggest times. If you've ever had the joy of uploading one of these, you kind of have them fire off at the right time. You could have them fire off at like 4:06 or something. But a lot of times the PR company will kind of set the time anyway. Oracle is out. Relay Therapeutics data. MongoDB is out. Record level demand for Oracle Cloud Infrastructure from AI. Who said AI is slowing down? No guidance in Oracle's press release. I think that's normal. Let's see how the market likes Oracle. It may have guidance, actually. Oracle looks like it's trading down. Although Oracle, the thing with Oracle is it's been too hot, right? Like, Oracle can never be good enough after their crazy run. Now look how much Oracle has run. The expectation's so high for Oracle. They could have walked on water and not had an uptick. Neumora, not along, no. Although I could see Neumora make it. Okay, 405 came and went. No biotech. Humacyte is still not up on the FDA website. It might be a quiet night. Well, AVXL, we're not really anticipating anything in the next few days. Planet down 21%. Oof. Looks like we are getting FDA actions. So if they approve 𝗕𝗢𝗘𝗏, I wonder if they're going to say something to Humacyte, because a lot of the FDA decisions all come in a cluster sometimes. There's nothing, I'm just searching the FDA website. We don't do sentiment analysis. We are going to do an interesting transformer pipeline. Sentiment analysis is so old. Oh, whoa, Lilly, 15 billion share repurchase program. Woof. What's hilarious is that's not even that much for Lilly. Nothing new on Moderna. I love that the headline is 15 billion repurchase program. Then it says cat sanctuary raises 12,000 pounds. I gotta love the news tape. Oracle showing some signs of life. Yeah, exactly, old sport. 50 times earnings? Why not? Give me the phone number of this cat sanctuary. The fallen tree branch demolished a new pen housing rescued cats. Stratford-upon-Avon. These are the Shakespearean cats. Some of the cats have vanished. The noise upset them a lot. How to zero DTE some of these cats? How do I buy these? Yeah, unfortunately for me, I'm probably one of the most well-known health CEOs. If you pass all the claims, then it's not insurance anymore. And the prices go up for everyone. Nobody could afford medicine then. It's not like I don't even understand how low these margins are for these insurers. Yeah, you just need to spend 20 minutes looking at one of the models. Let me show you. There's no real way out of this. Nobody would buy insurance if there was an insurance company that approved every claim. It's just silly talk. Let me show you. Simple numbers. Nobody likes to have a claim rejected, but the reality is that is literally how it works. So take a look. So last quarter, they took in 77 billion of premiums, okay? And they spent 65 billion on medical expenses. So they kept 11 billion. If they, let's say they decided to pay more, to instead of 77 billion, they approved everything, like you said. Instead of 33%, they approved. So that's after approving 33%. So instead, let's say they approved it all. That would be 240 billion for one quarter. Now that may not sound so bad, right? But say, who cares, right? The corporation is going to pay for it anyway. Well, that's true. The corporation does pay for it, but the amount of people on United Healthcare is around 40,000 or 40 million. Commercial domestic is 30 billion. Medicare Advantage, Medicaid, and Medicare Supplement should be different. So call that 49 billion. Community and senior, commercial global and Part D. Yeah, I guess this all counts. 73 billion. Seems a little high, but it's changed since I was a kid anyway. So 73 million, and we're multiplied by 4. So right now, per patient per year is about $4,000. If it went up to 100%, you would have PYPY of $13,000. So the customers, which are the corporations, would pay triple for healthcare if if they approved every procedure. United Healthcare doesn't make that much money. Look at the operating income is 10% margin. So that's a 9 billion, right, profit. But even if they said, we don't want to make any profit, that would cover almost none of the new costs. The new costs, let's do it on this number. The new costs, instead of spending 65 billion on medical costs, they would spend 139 billion more. But they only make 8 billion in a quarter. And a quarter is 90 days, right? So in one day, they would have to spend an additional 1.54 billion. So they would have 5 days before they ran out of money. It would now be losing money. If they lose money, they go bankrupt. So they would have 5 days that they could pay for all the extra costs out of their own pocket. Now, should the customer pay? Well, the customer is hiring the insurance company in the first place to make those decisions. The company, Microsoft or JP Morgan or Walmart, they go to the insurance company and they say, hey, we got a bunch of people, we want to insure them. Can you give them care? And the insurance company says, sure. If Microsoft goes to United Healthcare and says, pay for everything, you think United is going to say no? No, they'll say, sure, that sounds great. We'd love to do that. They go there and say, listen, pay for the important stuff, don't pay for the unimportant stuff. Don't let anybody waste money. And that's why claims get denied. Hospitals inflate costs because they have low margins too. And most of their customers walk out the front door. Because in America, you have a law that says you won't turn anyone away. So if you don't turn anyone away, and a third of people or half the people aren't paying, you got to raise the prices for everything. It is a little amount if you're talking about paying $77 billion of premiums. That doesn't even cover 5 days of costs. So it is a little amount. Yeah, it doesn't make a difference. You have to look at it in scale. You're talking about, oh, 8 billion is a big number. Well, what about 100 billion in revenue? That's a big number too. And if they're off by a few billion, they would be broke. Nobody is to blame here. If there's anybody to blame, it's the doctors. Doctors make a lot of money. We don't have enough doctors. And there's a cartel called the AMA that stops new doctors from being accredited. And the boards limit the supply of doctors. When you limit the supply of anything, the price goes up. Med school is made elite, and it's made limited how many med schools and how much graduation they could do, all accredited by the AMA, and it could all potentially be cheaper if we allow foreign doctors to come to the US, for example. Yeah, there's no big bad actor in healthcare. I think the nice thing is that we are going to get AI to lower costs. I do think AI is going to lower the cost of healthcare. And I also think drugs will continue to lower the cost of healthcare. There's some new cardiovascular drugs coming that I think will lower healthcare costs a lot. And AI technology will help people who are likely to be sick or likely to become sick sort of get healthier sooner. This guy was just a berserk guy that didn't understand healthcare, didn't want to understand healthcare, just had a tough time coping with emotions. And he's a psycho. Some people are glorifying him. Trust me, you're gonna have to try a lot harder to scare me.